message you give, but I sure hope we can come up with a better solution than that, although that might be what we're stuck with for a while.
Hi, I'm Kevin Parrott, and I've been working with Aubrey for about 6 years now, and I'm working with SENS Foundation with Sarah and Mike. And I'm also working with the Alberta government in Canada, where I'm from, and I've been fighting with them for about 4 years to try to get regenerative medicine on their agenda. And I've been talking with researchers at the University of Alberta, where I'm doing a biomedical engineering degree. And what I find mostly is that the healthy don't really care too much about the people, care enough about people who are suffering from degenerative diseases. And so what had occurred to me is that after 5 years of going around to lots of conferences and talking to lots of people, talking to private industry, is that the healthy, it's all academic. And so we have arranged and done a couple of, as a potential solution to how governments could generate the political will to give themselves permission to do these types of things, is to engage with those patient associations and caregivers that are looking after the people who are suffering right now, because that's truly an untapped amount of energy, and there's nobody more motivated. So I would just say that there's a responsibility on the part of researchers now, and Bill William Gaines here pointed out that charity groups are becoming quite powerful. If you look at Michael J. Fox, funding an awful lot of Parkinson's research. If you look at what happened to Proposition 72 in California, where they managed to overcome the stifling effects of the Bush administration's rules on embryonic stem cell research and a whole bunch of other things. The power is with the patients, the power is with those people who are suffering, the resources are with them and their caregivers. And the reluctance of politicians and the healthy and scientific to just continue to analyze and wait as a precautionary kind of a principle, the time has come to engage them. And I think that it's up to the politicians to try and enable those people who are working on grassroots efforts through private industry or through these patient associations. And so just to wrap up my own in November, in back-to-back events in Edmonton and Calgary, two major cities in Alberta, we're having patient groups come together who have never sat in the same room together, but we've had focus groups with them, and they're very willing to put their time, and they know that these treatments aren't coming around the corner for them. They're Alzheimer's patients often. They know that they're going to die before anything can be done for them, but they want to do something for themselves, for some hope, and for their children. So the answer is not necessarily with private industry, it's not with governments, it's with the people who are suffering, and that's where we need to go. And if you guys can think about ways that the governments can initiate these types of things, because the call is there, they need some help.
I'd like to thank the gentleman for that, because actually that is a really good point. We do, working on health screening, we work very closely with patient groups, etc. And I think it's a very, very valid point, and it's something that I'm actually going to take back with me and tell people about. And thank you for making the point.
Well, maybe I can answer. Yeah. So the first thing is it's always important for the grids to work with groups of citizens, and especially the groups of citizens who has health difficulties. And I can assure you that at least in my country, in Belgium, there are a lot of public money used for especially poor people who has health difficulties. But I would say, to be honest, that there is more public money to fight against the consequences of this disease, maybe that to try to find a solution to make it impossible, well, to stop this disease. But okay, but on the other side, it's not, the change will not be in Belgium, but in the entire scientific community making not a priority of postponing aging and postponing a specific disease related to aging.
I'd like to say thanks for that suggestion, because what you've come up with there is exactly the kind of thing that I was talking about earlier, saying what people are interested in. You know, when there's an election campaign on, we're knocking on people's doors and asking them what matters to them, and people are talking about the litter in the streets and things of that kind. Actually, that kind of human story, where there are real people who really are suffering with these kinds of issues, the issues of ageing, degenerative diseases, they're the kinds of stories that do move people. You know, when you have a story to tell about somebody who's really been through that kind of personal tragedy, that really does move people. So they are very much the kinds of things that can go into a political leaflet. So I'm really interested in that. Thanks.
I'm going to have to close up now. We've got about 4 minutes left. And I wanted to just finish with one question again from here, which is, you know, we have a lot of people in this room, we have a lot of people just outside there. In a very short number of sentences, what would you suggest the best forms of action are for these people to increase the profile of this work with politicians in a way that's likely to get the ball rolling much more quickly? Guy?
Well, I mean, plainly and simply, start engaging with politicians. I mean, you know, you all have your MPs or whichever country you come from, your political representatives. You know, contact them, send them emails, contact their office, explain to them what you're doing, the benefits of your work. Contact local politicians. Local politicians are actually very easy to come across and talk to. And you know, you might approach the health panel in your city or whatever, and talk to them and engage them and tell them, you know, how useful your work is and the applications that can be put forward. And by doing that, you're going to start enlightening the politicians, and they're going to start thinking more about it. They're going to realise they have alternatives, and they're also going to be informed as to what's coming next. So I think it's vital that everyone, you know, plays their part in this and pushes it forward.
I'd go one stage further than that and say, get involved yourselves. Getting involved in local or national politics is very easy to do, especially in the UK, because there are so few people who are really interested in doing it. So it's a great opportunity to increase the level of influence you have. And look, I'll just give you a personal story. 10 years ago, I became interested in this field through contacts with Nick Bostrom and Anders Sandberg, and maybe some of you will know those names. And at that time, had no involvement in politics. Now, I made a decision to join a political party principally to follow this cause, to try and ensure that there was an appropriate regulatory framework for the kind of things that we're doing, and to make sure that there was a source of funding available. Now, I'm now a governor of the Local Hospitals Trust. I'm also on the Health Overview and Scrutiny Committee on the County Council. Whenever there is a health story in the area, the local press always contact me for a quote. If you do a bit of searching on the internet, I'm sure you'll find some of them. So I'm now able to have some influence over what happens in the public sector, what happens in the NHS in the UK. Any of you could do that in your own environments, in your own countries or in your own localities. Get involved. It's really easy to do, and you could be the people making those decisions.
Thanks, Ryan. Didier?
Yeah. First, as I said already, I think that you are working very, very efficient, but there is not so much contact with the press, well, each euro that it's used for scientific research in this domain will not be used for scientific research in I don't know, arm race and so on. I think also, but that's very important to explain all aspects concerning the precautionary principle, and well, for the rest, postponing age should be something so easy to explain that honestly I sometimes I don't understand why it's not starting to become something central in the press, because we are really in a very rich region of the world where we have money enough to invest in these fields.
Thank you, Didier. That's our time. I'd like to ask you to join me in thanking the panel, Didier, Coeurnelle, Darren, Montrose and Darren.